So, health and safety is the duties and responsibilities of employees to support a safe work environment and the duties and responsibilities of employers in safety management. A health and safety checklist could consist of walkways and entrances. Entrances must be easily accessible and well lit. Emergency exits should be kept free, so no obstructions or obstacles. Non-slip towels in change rooms and around the pool, obviously so that people don't slip and cause accidents or whatever. There must be signage enforcing rules in the pool area, also big signage and big and clear, so that there's no leeway for people to say that they didn't see it or they weren't informed. Equipment and machinery must be in good condition and accessible to members and employees. So machines mustn't be on the verge of breaking because that'll obviously put you at risk as a business owner. Machinery must contain instruction place cards. Now that's for if someone doesn't know how to use a machine, they can always look on the machine on how to use it, and then you have no liability in them getting injured if they use the machine wrong. Different areas need to be indicated, as well as safety rules and notices to children, new members, and the disabled. So obviously the cardio area should be labeled the cardio area, the weights area should be labeled the weights area, and which bathrooms and change rooms, and that is specifically for the disabled, the children, and also so that new members know where everything is. If a machine is out of order and it needs to be shown, if a machine is out of order, it needs to be shown with signage until it gets repaired. Now, obviously, so that people don't go and get on a broken machine and do something and then get hurt because the machine is broken. So you just label that it's out of order until it gets repaired, obviously, when it will not be out of order anymore. Appropriate safety equipment should be available when handling hazardous substances. So obviously, if it's something can burn your hands, like a chemical, you should provide gloves, or if it's a toxic chemical, you should provide some kind of mask so that you don't inhale it and damage your lungs. Firefighting equipment should be made available just in case any short circuits occur or any type of fire starts, so that it's easy to get the situation under control. Should have a systemization of workings just so that everyone's on the same page, so everyone works towards the same goal at the end of the day when there's a accident, so it's not two people conflicting their interests, and that it's just one system working together to maximize the efficiency of the protocol that they are following. Employees should be suitably qualified to be effective and manage risks. Obviously, so that if it's a personal trainer, they need to have some kind of first aid background or something, because these things do happen, and then they know how to handle the situation when someone gets hurt, or they know what not to do. More importantly, so that they don't injure the person more and become liable for further injury. Ensure that all employees are trained about their responsibilities. So, for example, if someone isn't very good at swimming, they shouldn't be in charge of the swimming pool. Just like if someone doesn't know much about weightlifting, they shouldn't be put in charge of the weightlifting area, because it's just gonna cause problems, and then the liability could be put on the business. So that's the checklist. Some health and safety issues about if I had to turn my house now into a studio or gym is minimum sanitation, which can obviously be fixed, but at the moment we just have enough soap and that for us and not a whole group of people that are coming in to train or exercise. There's no ramps or adaptation for disabled people, because obviously nobody is disabled, but it's just not it's not something that's been done. So it's only steps, and yeah, it's only steps, no ramps, nothing. No non-slip tiles in the bathroom now. Yeah, it's just normal tiles. I've slipped so many times, and there's no extra handles or anything, to hold on to or whatever. So yeah, no firefighting equipment. So if a fire breaks out, the best thing that you can probably do is just get out of here and lose everything that you've left inside, because there's no fire extinguishers or nothing. So yeah, those are some health and safety issues that can be worked on. Potential risks or hazards would probably be now basically the same thing as what I've just said, but in a different context. So slipping and tripping when your feet are wet and you're walking into change room or bathroom, whatever, would be slipping. Tripping because probably because they're on any weight racks and that, but I mean, you can always get that. A fire, there's no fire extinguishing materials or anything, or equipment. Social hazards would be one, because that's something that you can't really control. It's alcohol abuse or steroid abuse. So that's not really something you can control, but you can try limit as far as you can. So that's something you need to be on the lookout for. And psychological risks or hazards also can't really be under full control, but it can be picked up and just monitored. Psychological risk or hazard would be stress and fatigue. So obviously from work, someone's stressed out, and fatigue because they don't get enough sleep or something like that. So yeah, to create a risk management procedure, you need to know all the laws that apply to the SRF sector. Okay, you then need to develop risk strategies which reduce the occurrence of medical emergencies. Okay, so obviously putting measures in place that reduce the amount of people that get hurt in your gym. Because obviously the less people that get hurt in your gym, the less people you will have to worry about suing you or if they're okay. So yeah, next you should develop a policy and procedure manual for all employees to access, just so that they can keep themselves refreshed on what's supposed to happen, so they can come and look at it, read over it, just to refresh their memory. And then last of all, you need to finalize the risk management plan and have it revised and improved annually. So when someone picks up an error, or not an error but a shortfall, then every year when it gets revised annually, you can add it or discuss it or maybe improve on something that's there, so that it creates a better environment for everyone who's using the facility. Thank you.